Hello, and welcome to our channel, where we provide educational resources on EKG analysis. Today, we will be analyzing atrial fibrillation in an EKG strip. Atrial fibrillation, AFib, is the most common type of heart arrhythmia or abnormal rhythm characterized by an irregular heartbeat. It occurs when the heart's upper chambers, the atria, contract chaotically and out of sync with the lower chambers, called the ventricles. In AFib, the electrical signals in the atria become disorganized, causing the atria to quiver or fibrillate instead of contracting in a coordinated manner. Causes of atrial fibrillation include coronary artery disease, myocardial infarction, heart failure, and chronic obstructive pulmonary disease. It is a relatively common condition that affects millions of people worldwide, particularly those over the age of 60. Some people with AFib may not experience any symptoms, while others may feel palpitations, shortness of breath, chest pain, fatigue, dizziness, or fainting. AFib can be classified as paroxysmal, meaning it's lasting less than 7 days, persistent, meaning lasting longer than 7 days, or permanent, meaning it's continuing indefinitely. AFib is a serious condition that can increase the risk of stroke, heart failure, and other complications. AFib is associated with a 5-fold increased risk of a stroke, especially if the heart rates are elevated to above 100 beats per minute. AFib is a common cause of hospitalizations in the United States, with over 400,000 cases being admitted every year with over 150,000 deaths yearly. Let's take a look at an EKG strip that shows atrial fibrillation. As you can see, the rhythm is irregular, with no discernible P waves. This is because the atria are not contracting in a coordinated manner. Instead, they are quivering or fibrillating, which creates multiple small electrical impulses that spread through the heart and cause the irregular heartbeat. We shall be using the 6-step method to do a basic analysis of an EKG strip showing atrial fibrillation. The following steps can be used to analyze atrial fibrillation. Step 1. Examine the EKG strip for an irregular rhythm. Atrial fibrillation is characterized by an irregular rhythm, which means that there is no discernible pattern to the heartbeats. Atrial and ventricular rhythms are remarkably irregular. As demonstrated in this EKG strip, you can see that the P to P intervals cannot be discerned and the R to R intervals are not consistent. Step 2. Determine the heart rate. Since the heart rate is often irregular in atrial fibrillation, it may be necessary to count the number of QRS complexes over a longer period of time to get an accurate heart rate measurement. The heart rate is important to know since it plays a significant role in determining the treatment plan of the patient. Atrial rates would usually exceed 400 beats per minute, which reflects the quivering of the atria. The ventricular rate varies from 40 to 250 beats per minute. AFib with a ventricular rate of 100 or less is called controlled AFib, while AFib with a ventricular rate above 100 bpm is called uncontrolled AFib. Uncontrolled AFib are often treated with anticoagulants, or blood thinners, and rate-controlling medications to mitigate the risk of a stroke. In this example, since the rhythm is irregular, we have to use the 6-second method. This particular strip has a ventricular heart rate of around 90 beats per minute, which means this is atrial fibrillation that is controlled. Step 3. Look for the absence of P waves. In a normal sinus rhythm, each QRS complex is preceded by a P wave, which represents the electrical activity of the atria contracting. In atrial fibrillation, the atria are fibrillating instead of contracting, so there is no discernible P wave. Instead of P waves, we may see fibrillatory waves, also known as F waves, which represent the uncoordinated quivering of the atria. Step 4. Determine the PR interval. In atrial fibrillation, the PR interval is not measurable since there are no P waves to speak of. Step 5. Measure the QRS complex. In atrial fibrillation, the QRS complexes are usually narrow, measuring less than 0.12 seconds, unless there is an underlying ventricular problem which can widen the QRS complexes. Step 6. Interpret the findings. To summarize, atrial fibrillation is generally an irregular rhythm. Ventricular rates that are 100 or less would mean it is a controlled AFib, while ventricular rates above 100 would mean it's an uncontrolled AFib. P waves are not identifiable or are fibrillatory waves. There is no measurable PR interval. The QRS complexes are normal, meaning less than 0.12 seconds in duration. In conclusion, atrial fibrillation is a common heart rhythm disorder that can be easily detected on an EKG strip. The irregular rhythm and absence of identifiable P waves are characteristic of this condition.
Thanks for watching. Subscribe and smash the like button. It will cost you nothing, but it will help us immensely.